Hi, we're here today with Dr. Kate Callaghan. She is the Chief Resident with the Memorial Hospital Family Medicine Residency Program. Dr. Callaghan, thanks a lot for joining us.
Yeah, happy to be with you. Thanks for the opportunity, Heidi.
So we're here to talk about 3 weeks ago, Beacon Health System started our mobile COVID testing clinic. Basically, it's a clinic on wheels. We travel across St. Joseph County, Elkhart County, and in the last 3 weeks, we've tested more than 700 patients. Why did we start this clinic? What's the idea behind it? Where did it come from?
Yeah, I think, going out into the community and making this move in the midst of the pandemic was really smart on a lot of levels. First of all, I think those patients that we're testing win. They're having the opportunity to get affordable and accessible tests. Many of these folks are in lower socioeconomic backgrounds, and we know that this virus is disproportionately affecting those communities. And in a lot of senses, that's because of a lack of access. And so by Beacon going and really moving into the neighborhood, if you will, that really eliminates that barrier and creates opportunity for these patients to get the testing that they need. In addition to that, though, I think we also win as a community. Whenever any one of these cases is identified, we have a better sense of how to move forward with pursuing isolation and quarantine for those folks, and that prevents them from being out in the community and spreading this virus to others. And then finally, as a health system, I think we gain a lot of ground here as well. As a clinician myself, the folks that I'm really concerned about and thinking extra hard about in these days are those that have chronic conditions, that are chronically immunosuppressed, that have chronic lung disease, those that are much more at risk for having complications with coronavirus that really lead to poor outcomes. And those are the folks that we need to have presenting at the hospital, at clinics, at urgent care for the various needs that they're going to have because of their underlying disease processes. And by allowing for us to address the COVID issues in these community clinics, pursuing the affordable and accessible testing there, that eliminates kind of the cross-contamination, if you will, with these more high-risk patients. And so I think that's also a huge win in this for those patients and for us as clinicians trying to care for those folks.
So a lot of wins all around. So is this as successful as it sounds? I mean, 700 patients in 21 days sounds like a lot. How would you characterize it?
Yeah, absolutely. I think we're getting great turnout at these events. And in addition to that, while the percentage of positives that we're seeing is low, thankfully, we are seeing multiple positive cases with every one of these mobile clinics that we do. And in light of that, again, as I mentioned before, with every one positive that we identify, that's potentially allowing for 10, 20, 50 people to have minimized exposure by quarantining that person that might have gone out to the grocery store or might have gone to work if they hadn't had this test. And so I think absolutely we're having success with this, and we're grateful that the numbers are small in terms of the positive tests that we're seeing. But with having those positive tests, even one positive test that's prevented has multiple folks that are benefiting from that.
For sure. So you're actually working out in the clinic, screening patients. Can you talk about the experience in the neighborhoods that you're in?
Yeah, it's been great to have the opportunity to be out there. I'm really grateful to my program director for letting me be a part of that effort. And I've been really impressed by the Beacon staff that I've worked with there, just the sense of camaraderie and teamwork. And, really they've been doing this for a couple of weeks before I showed up there, but it's a pretty streamlined process. We really keep folks in their car. We minimize the amount of things that we're passing between us and patients to really try to minimize exposure as best we can. Folks are decked out in PPE for the whole 3.5 hours that we're out there. And I think we're doing this about as safely as we could be. And as someone who really has a heart for taking care of folks that are under-resourced and really do have needs, it's been an opportunity to kind of live into that in a fresh way, and something that I've really enjoyed doing. So super grateful to have had the opportunity.
So if someone's watching this and thinks that they might have symptoms of COVID-19, what do you advise them to do? And, I'll also ask what the process is if you do advise them to go to a mobile testing clinic. What's the process that they can anticipate?
Absolutely. So, if you are having symptoms, we have a pretty low bar for testing at these clinics. Honestly, if you're having any symptoms, whether you've had a known exposure or not, we will move forward with a test and would encourage you to come out and get a test. As we mentioned, for folks that have Insurance, we will, utilize that, but we don't want this to be a barrier for folks that don't have insurance. We still want them to come. And so in terms of the process that we go about, we do have to have an identification card of some sort, just because we want to make sure that we can identify who exactly we are testing to ensure that the results get conveyed appropriately. So definitely bring an identification card with you if you come out to one of our sites. Bring an insurance card if you have it. But again, if you don't have it, don't let that stop you from coming out to see us. And then essentially you'll just pull up in your vehicle and we'll get some information from you about your medical symptoms. And if you're having symptoms, we'll kind of pass you down the line to our registration folks so that we can ensure that we have adequate contact information, both with telephone and address, should we be unable to get a hold of you by phone. And then we'll go ahead and swab you as well. And you can expect to hear from us usually between 3 to 5 days with the testing results.
It's an amazing opportunity for folks out in the community, and any other messages for them as we talk about this clinic moving forward?
Yeah, I mean, absolutely. Stay well, stay safe, stay home when you can, and know that we're so grateful for the immense support from the community that we've received as well. It's actually, really meaningful and purposeful time to be in healthcare. And as someone who's just really starting my career, I've just been so encouraged by this community and really, really blessed and thankful to be a part of it.
Dr. Callaghan, thank you so much for your time today.
Absolutely. Thank you.